God, another day of pain.
रामू काका, चाय लाइए.
Good morning, darling. So how are you feeling today?
What's so great about the morning, huh? It's just the same, as painful as usual.
रामू काका, चाय कहाँ है?
Bhagwan, will this irritability ever end?
अरे काका, where is my चाय?
Huh? Oh my God! Why is it so dusty here? And all these buttons, why are they not in their place? Huh? देखो तो क्या बनाया है आपने आज? इतना सारा तेल? No wonder सबके दिमाग में चर्बी चढ़ रही है यहाँ. हाँ. Oh, it's so hot in here. These hot flushes are going to kill me. Oh, it's so hot. Oh my God. कमला, क्या कर रही हो? ऐसे झाड़ू लगाते हैं क्या? ला. आए, ये कमबख्त दर्द. Even medicines are of no use. क्या करूं मैं? इसे कब तक सहूं?
This is the story of Kavita Gupta. She is a little over 51 years of age and is having her menopause. Her condition is just like many women who are also going through menopause. Irritable, painful, energyless, wishing for some miraculous cure to get rid of it all. But perhaps things will be easier if you understand that some things are inevitable with age. The body, after all, does take a lot of wear and tear over the years. However, it is also true that understanding the problem makes dealing with it a lot easier.
Mom, I can't take this anymore. I find this feeling so hopeless, so depressing. I'm constantly irritable. I can't sleep and my marriage is suffering. I just don't know what to do.
बेटा, don't worry. This is normal for your age. सब ठीक हो जाएगा.
Menopause means stopping of menses, usually setting in 1 year after the final menstrual period. This is the period when a woman's ovaries gradually stop functioning, leading to a variety of symptoms due to deficiency of estrogen, the female sexual hormone. Estrogen is responsible for the development of feminine features. It helps to maintain the bone strength and also in preventing heart diseases.
Very late, Kamini.
Oh, thanks. Much needed.
Wanted to tell you something, Kamini. You know, this menopause, it's really getting to me nowadays. I'm feeling so depressed. My body's hurting all the time. I can't even sleep. Oh my God. You know, life seems to be like hell sometimes. And you know, Kamini, my mother tells me that everything is just fine. I don't understand how. Really? Have you been to your doctor? Haven't you got yourself checked yet? No, yaar, Kamini. My mom says everything is just fine. And you know, all this happens when you cross 50. But do you think I should see a doctor?
Of course you must. You must see a doctor when you reach menopause. So many changes take place in our body, you know. I felt the same problems, same feelings, same pain. It's true, it happens in menopause. But you don't have to go through so much of suffering. You can lead a perfectly normal life. Don't delay meeting your doctor.
Yeah,
Of course.
good evening, doctor.
Hello, Kavita. How are you? It's been a long, long time. So, how's everyone? और क्या problem है?
Everyone's just fine, doctor, except me. I'm not sure what it is. I'm 51. I know it is menopause. But you know, sometimes my back aches badly. Painkillers don't even help. Then my body aches. Insomnia, irritability, depression. These are permanent. And God knows what else, doctor. I just can't take it anymore.
Okay, first let's take a look at you. It's time you had your medical checkups regularly. You look okay. With slight medication, you'll feel much better. We'll do some tests. Let's see. Just get this test done. Bone densitometry. This one is a must. I want to check you for osteoporosis.
I'm really worried, doctor. What is osteoporosis?
After menopause, bones start becoming weaker, leading to a disease called osteoporosis. It's a fairly normal occurrence among women of your age and similar lifestyle. Osteo means bone and porosis means with holes. Osteoporosis is a common health problem affecting nearly 65 million Indians. But don't worry, Kavita, osteoporosis can be prevented and controlled.
After stopping of menses, since there is no estrogen production, the bones of women start becoming weaker, which may lead to osteoporosis. Osteoporosis is a disease of the bones in which the bones become very weak and fragile. Such bones become prone to fractures for apparently no reason at all, like getting down the stairs or being hit by furniture when walking around the house. In case of severe osteoporosis, fractures can develop even due to minor acts like lifting a bag, hugging a person, and even sneezing. Nearly 80% of osteoporotics are women, with postmenopausal women being at the greatest risk. In fact, 1 out of 2 women and 1 out of 8 men worldwide suffer from an osteoporosis-related fracture. What's even more amazing is that 23 lakh people are added to these numbers every year. Some factors that increase the risk of osteoporosis in postmenopausal women are adverse family history, early menopause, hysterectomy, chronic intestinal disorders, using corticosteroids and thyroid medication, sedentary lifestyle, consumption of alcohol, low calcium diet. Postmenopausal osteoporosis, or PMO, is the most common type of osteoporosis. It is usually a silent disease until the occurrence of a fracture. Symptoms include back pain that does not respond to painkillers, loss of height due to compression of the vertebral column, and kyphosis, or development of a hunchback.
Now get your densitometry test done today. Don't worry, you'll be all right.
The most reliable way to detect osteoporosis is bone densitometry with the help of densitometers. Densitometers work through ultrasound or by dual energy X-ray absorptiometry or DEXA. Densitometry helps in detecting osteoporosis much before the occurrence of fractures. It predicts the risk of fractures. It determines the rate of bone loss, and it helps in monitoring the effect of treatment given for osteoporosis. All these reasons make bone densitometry a very important test for postmenopausal women to test their bone density for osteoporosis.
So Kavita, your densitometry test shows you do not have osteoporosis, but there's a slight decrease in your bone strength. But nothing to worry. It can be easily controlled with the right lifestyle and regular medication. If you follow my instructions properly, you will not get osteoporosis. You know, Kavita, like you, there are millions of other women who are menopausal and at risk of developing osteoporosis. And the best part is, osteoporosis can be easily managed. There's nothing to be scared of.
In fact, it can even be prevented in 6 simple ways. 1. Have a diet rich in calcium, include milk, curd, cheese, broccoli, lettuce, spinach, and mustard greens. 2. Exercise regularly because people who do so have stronger bones than those with a sedentary lifestyle. 3. Get adequate sunlight. Exposing the body to sunlight aids the formation of vitamin D, essential for calcium absorption. 4. Avoid excess salt in food, as salt can increase the loss of calcium from bones, making them weak. 5. Avoid smoking. Smokers are at a 40% higher risk of getting fractures as they lose calcium from their bones faster. And 6. Stay off alcohol, as alcohol weakens your bones by reducing the body's ability to make new bone after removal of older bones.
After menopause, it is wise to check your bone density through a bone densitometry test every year. Take these medicines to prevent osteoporosis.
Should I take any extra medicines? Are calcium tablets not enough?
Calcium is important, But you need special medication to improve your bone strength further.
The best and easiest way for postmenopausal women to manage postmenopausal osteoporosis is to see their doctor regularly for checkups and follow any recommended treatment diligently and faithfully.
You know, it's been 6 weeks of treatment. I feel so much better now. In fact, I feel like a new person altogether. You know, life has really improved. All the constant backache, irritability, insomnia and depression is all but gone. I feel like a new woman. You can too. You know the easiest way to do it? Just see a doctor and do it today.